Susan Michie is Professor of Health Psychology at University College London. Her research covers the area of behaviour change. During her talk, she mentioned that when aiming to change a particular behaviour, it's important to understand the context in which this particular behaviour takes place. Could you tell us a bit more about this?
What we know is that behaviours are part of a system of lots of other behaviours. So, for example, if one wants to try and go down to the gym to have some exercise, it's not as if it's going to the gym versus not going to the gym. There are other attractive behaviours. For example, lying on the sofa, eating crisps, drinking wine, looking at the television. So one has to think about how to increase a behaviour and decrease other behaviours if one's going to change behaviour. So one of the things is to think about what other behaviours are there that actually get in the way of doing what one wants to do, or what other behaviours are there that could actually help. The other thing we know about behaviour is that it's not just part of a network of behaviours within you as an individual, but it's also very influenced by other people's behaviours. So we know, for example, that if you have a buddy, say, to go to the gym with, you have some social support. If you feel like not going to the gym, the other person may be phoning you up saying, where are you? And also one's actual material environment, the context of a behaviour that we actually live in. How many people can afford to be a member of a gym, have got a gym near them? Not many. So the behaviour can be influenced by other behaviours of oneself, other people, or actually the situation and the material context in which one lives or works.
In order to identify what the active ingredients for behaviour change are, it's important to very precisely characterise behaviour change techniques. Can you tell us a bit more about your work in this area?
If one wants to identify the kind of behaviour change techniques that are likely to be effective, it's really important to understand the behaviour and what needs to change. So if we take a very simple model of behaviour and behaviour change, we can think about there are three aspects of behaviour that need to change in order for a behaviour to occur. Those three are motivation. Somebody needs to be motivated to actually enact a behaviour. If they're not motivated, it's not going to happen. Secondly, they need to have the capability, whether it's a psychological capability in terms of skills and knowledge, or whether it's physical capability. If they don't have the capability, the behaviour is not going to happen. And thirdly, they need to have the opportunity, both the physical opportunity, but also the social opportunity for the behaviour. If you don't have the opportunity, it doesn't happen. You could then think about what kind of intervention is likely to be most effective, and then identify specific techniques that might be helpful. Those areas have a number of behaviour change techniques associated with them. In fact, we've identified 93 different behaviour change techniques. Now, when you want to develop an intervention to change behaviour, of course one doesn't want to have huge numbers of techniques, and often less is more. It's better just going with one or two that are really likely to be effective given the behaviour and context that one's already analysed. And so we've developed different frameworks and different sets of criteria to help people think about which of these techniques are likely to be most effective, dependent on the analysis of what needs to change to bring about that behaviour.
What are important elements to maintain behaviour change?
Changing behaviour is not easy, as we all know, but actually maintaining behaviour change is even more difficult. The absolute key thing is to ensure that that initial enthusiasm and motivation gets translated into strategies that can support the change long term. Things like building up habits and routines so that when people are in particular situations, they do the new behaviour rather than the old behaviour, and there are ways of achieving that. One of the key things is to think about how to change routines and how to change one's environment, one's physical and also one's social environment, in order to support the behaviour change. What tends to happen is people have this initial burst of enthusiasm, things do change for a bit, and then it kind of fades away, and then people get demoralised. So the key thing is to think long term right from the beginning. as we know, people do achieve very impressive changes in their behaviour, whether it's diet, physical activity, stopping smoking, etc. But one might as well start off with all the tools in place at the beginning rather than halfway through scrabbling around trying to find them.
Food Today. Science-based information on food, nutrition and safety. From EUFIC, the European Food Information Council.